Hi, I'm Dr. Rajani. Thanks for joining me. We're going to watch a video on hand rejuvenation with a permanent product called Bellafill PMMA polymethyl methacrylic acid. Sometimes you see Radiesse in hands, it's FDA approved. Also Restylane Lyft, a hyaluronic acid. In this case, I'm going to show you Bellafill PMMA being used with a micro cannula to rejuvenate the hands. It was asked by a viewer if I could show more in the hands. Let's dive into it in 3 seconds. So remember, if you like the videos, click like, subscribe. It helps us with our algorithm here, helps improve and grow our channel. Click the bell so you'll be informed of all the upcoming videos as they occur. And remember, there's a search button here. You can see it right here. This search button within the channel allows you to search for any topic you might be wanting, or you're thinking of asking me, hey Rajani, do a video on this. Chances are it's been done. If not, let me know. We'll do a new one or we'll update it. Now, hands. The hand region, when people ask where it is, it's from the well, we call them the metacarpal phalangeal joints, for the metacarpals, from this area down to the wrist. It does not include the fingers. There are things you can do, but mainly we're talking about the back of the hand here, and I'll show you the injections. A lot of people who do this tend to be people using their hands in videos, pianists, people where their hands are a focus, magicians, or people who use them a lot just get wasting, and as we age we get wrinkles and folds. Now, skincare, a lot of people forget about using it in the lower neck in this region. Also on the hands, you can use retinoics, you can use vitamin C's, all your antioxidants. Sunscreen, of course, a lot of people forget to use it there, but prevention is key, because if you never need fillers, you never need these treatments, all the better. So remember to take care of the skin here, and I'm going to show you a device quickly too that we're using on the hands before the PMMA filler. And what that does, it's an injectable radio frequency device that rejuvenates the skin just like we do on the face with our plasma glow procedure, and that helps build collagen, it gives glow, and then we do the filler for volume. So it's really a two-step process. The superficial skin, brown spots, and remember, chemical peels and other things are also viable options for the hands. Let's go to the video. We'll watch it being done now. So here you can see we're cleansing the hands first, and I use either 70 to 90% alcohol. Puricin is much more common now. Creating the opening for the cannula, and then inserting the cannula. In this case, it's a 27 gauge. Most commonly, I'm using a 25 or even a 22 lately. As we create the opening, then we insert the long cannula, because this is a 1.5 inch. A lot of times we use 2 inch. You can bolus, so you can put a large area, and you'll see a little bit of bolusing here. And then you can smooth it out. It's a great way to do it, but you can also inject along those hollows. Now with this one opening, we can reach most of the hand. Rarely do people want it between the thumb and index finger, because those muscles create volume, but you can see the filling that's occurring here right along the region in between the patient's second and middle finger. And we'll still smooth that out, but we can lay down the product first and then afterwards massage it through. Now we're using 1 syringe here so far. It's not uncommon to use 1.5 syringe per hand. Come back at about a few months time after this has built its collagen, and then we will add anywhere from 1/2 to another syringe. So the average might be 2 to 3 syringes per hand. And keep in mind, a Bellafill kit, which is known as Artefill prior, a Bellafill kit is 5 syringes in it. Most people buy a kit for the hands and a kit or 2 for the face. It's a long-lasting product, so in that sense, it's cost-effective, and it will build collagen in and around the hand to help plump it. There can be a little swelling after the procedure, but most people don't mind it in this region. In terms of movement, very rarely is movement affected, and if it is, it's usually only for a few days. Very little blood involved with this procedure. I hold a little bit of pressure, and then at the end here, what we're doing is massaging. I'm massaging the hand to smooth it out. I use a little bit of gel for that area, and it just smooths it right out. Now, before or after the procedure, but a lot of times before, what I'll do is this radio frequency procedure that you see here. You can see it's a roller application going back and forth along the hands, but it's actually going to stimulate collagen and provide that top layer of skin with less brown spots, tighter skin, and then the Bellafill works from down below. So there you go, that's Bellafill in the hands, hand rejuvenation. Do you do it? Do you like it? Are you even interested in your hands? Or are you putting more of the funds towards your face and neck before worrying about the hands, which is common? Let me know in the comment section. Join, subscribe, keep your skin and body beautiful, healthy, vibrant.